Welcome, my friends. I am Glynis Chester, your host of the NFRW Empower Hour, the series that provides in-depth discussions on topics that are forefront in today's political landscape. We want to give you the ability to talk with authority on every issue and topic that is the forefront of politics today. So we bring you the best speakers, the best topics, everything you see in the news. We bring the discussions to you so that you can have all the details of what's going on in Congress, what's going on in the Senate, and give you all of the knowledge, all of the tools to speak with authority. So I thank you for being here with us today. I am so excited about today's program. I don't know about you, but it's amazing to me that when the other team manages somehow to elect a majority, they're ready to go on day one. And I feel like, well, no, it happens that when the Republicans elect a majority, we don't get everything done that we say that we're going to do. So today we are going to talk about healthcare and having a viable plan to do something about the catastrophe that is healthcare in this country. We all know that it is a hot mess. And we've been promising and promising and promising that we were going to do something. And today we're going to really get into the weeds and figure out how can we have a viable option to make healthcare great again. I'm also going to throw you a little curveball because I like to shake it up and I don't want you to get bored with our program. So we're going to have a panel discussion instead of just me talking one-on-one with our guests. And our panel discussion is going to be led by a very, very dear friend of mine, Christy Antonick. She is on the program committee with me. She is also on the Texas Federation board as our partnerships chair. She is a rancher here in Texas. She is a patriot. She is a woman of God. She is one of those people that when you think of God, family, country, you think of Christy. And I couldn't think of anyone better to talk to you today about healthcare and how important it is to everyone in our country. So she's going to lead our panel discussion today. And I'm just so excited to have her here. But before we get into the meat of our program, I would like to do just a little bit of housekeeping. I want to remind everyone, please keep yourselves muted. If you have any questions, please put them in the chat and we will get to as many of the questions as we can at the very end of the program. Thank you again so much for being here today. And also I want to give a big shout out to my buddy, Erica. Erica is here. She's doing tech for me tonight. And you know, we're kind of the dynamic duo and I've missed not having you with me the last few programs, but I'm glad to have her back here tonight. So without further ado, Christy, I'd like to toss it over to you and let you get started with tonight's great program.
Thank you, Glynis, and thank you to each of you that are tuning in tonight. The NFRW is made up of 60,000 plus women. We are daughters, wives, and mothers. And as such, it usually is us who take family members to the doctor. It's us who's looking over the statement of benefits, or us who's trying to figure out who we're supposed to pay, what we're supposed to pay, and even how we can pay it. So like so many people across the country, we think that healthcare is too complicated, it's too expensive, and there's too many middlemen in between the patient-doctor relationship. As politically active women, we think there should be solutions, right? And so tonight, we are so excited about our program because we're bringing to you elected officials and policy experts to show you that there is a plan and where you fit into that plan. Tonight, our panelists will talk about where healthcare is at today, where they think it should go, and how we as NFRW women can help them get it there. So our first panelist is Congresswoman Mariannette Miller Meeks. She took office as the U.S. Representative for Iowa's 2nd District in January of 2021. Her background includes 24 years of military service in the U.S. Army, where she served as a private, a nurse, and a physician. She has owned her own practice, She organized a physician recruitment and retention program, and she was the first woman president of the Iowa Medical Society. Our second panelist is a policy expert, and she knows the ins and outs of healthcare. Melissa Faust is Director of State Government Affairs for Americans for Prosperity. Originally a policy analyst for AFP Florida, today she works with AFP's state chapters, coalition partners, and allies inside of state houses to enact good policy. She has testified before legislatures across the country, and her commentary has been featured in National Review, Forbes, and The Hill. I just want to say thank you to these ladies for joining us. Their expertise is going to provide us with information that we can use to help push good policy across the nation. So let's just dive in, ladies. Healthcare is a complicated issue. More than 75% of voters believe that the US healthcare system is in a state of crisis or has major problems. And voters overwhelmingly want candidates who have specific plans to address healthcare costs. So Congresswoman, from your perspective as a doctor and as a member of the GOP Doctors Caucus, what is the current state of affairs on healthcare in Congress?
Well, I would say, first of all, let me just blanket talk about healthcare in the United States. And so we have a healthcare system that truly, in many facets, is the best in the world, especially when that comes to specialty care, when it comes to treatment of cancers, treatment of chronic diseases. Very few countries will match what we can do when we're treating chronic disease or our cancer survival rates. However, we do have issues with affordability. Cost is way too high. We have issues with access. And then we also have the issues of people taking personal responsibility for their own healthcare. And part of that emanates from how our healthcare system started and how it was funded after World War II. So that's sort of where we are in the mix. So I would agree with you and with Americans when they're polled, when they say our healthcare system is too expensive, it is too complicated, it's difficult to navigate. There are middlemen. So there are middlemen when it comes to pharmaceutical and pharmaceutical benefits, cost of drugs. There are middlemen when it comes to, between you and your doctor or the doctor-patient relationship, as you mentioned. So we know that those are faults within our system. And then we also have, after the Affordable Care Act, more and more coverage that's provided by the federal government, which makes it a lot easier and a smoother transition for the opposition party or the Democrats to get what they want, which is a single payer Medicare for all system. But let me also say, when you're talking about messaging and what can you all tell people, when the Democrats talk about Medicare for all, that isn't going to be the Medicare that some of you already experience, because it's not going to be this blended fee for service when it's all a government-run healthcare system. It will be more like the VA or the Native American healthcare system. So what's the state in Congress? Currently, as you know, the Democrats have a majority in the House and they have a majority in the Senate. We know that as Republicans, we talked extensively after Obamacare was passed that we were going to, end Obamacare. We got the House. We did not get the Senate, if you recall. They did Obamacare. They rammed it through budget reconciliation when Scott Brown won the Senate seat in Massachusetts. And so once a government program has been in place, and I think Ronald Reagan said that there's nothing so permanent as a government program. But once Obamacare was in place for several years, it became more and more difficult in order to try to repeal it and or replace it. When we got the majority again in both the House and the Congress, we were unable to pass repealing Obamacare and replacing it. So now we're with a system that has dramatically increased cost. Premiums have skyrocketed. If you recall, one of the ploys that President Obama used was that it would reduce premiums by $2,500. You'd be able to keep your health plan. You'd be able to keep your doctor. None of that proved to be true, as we know, and premiums have continued to go up, such that even in the exchanges, the amount that people are having to pay out of pocket is exorbitant. And it's much more than what they had to pay prior to the implementation of the Affordable Care Act or Obamacare. Within Congress, one of the things that we're trying to do, we're in the minority party right now, but we anticipate that we're going to be in the majority next January. So in less than, I think it's like 56 days will be the election, and we're hoping to get the majority in the House. We're also very hopeful that even though some of our tailwinds have waned a little bit, that we'll still be able to get a majority in the Senate. And if so, how can we pass legislation and how can we govern? So that's a big issue for us. So what the minority party has done under the leadership of Kevin McCarthy, the minority leader, is to set up a variety of task force. So we have a variety of task force on issues such as crime, on energy independence, on climate and the environment, on business, small business growth, on internet and tech, privacy, and then on healthcare. So there is a Healthy Futures Task Force. I'm the chair of the Modernization Subcommittee of the Healthy Futures Task Force. The other parts of it are on prevention, affordability, access, doctor-patient relationship, privacy. So in that arena, we're actually looking at how can we prepare for legislation. Some of it may be small because we won't have the presidency until 2024, but others of it may be bigger pieces of legislation that we put forward. What I'm doing on the Modernization Subcommittee is working with two other members, Representative Mike Kelly from Pennsylvania and Representative Morgan Griffith from Ohio. And so, and I may have that wrong, so I apologize. But we wanted to look at prevention, we wanted to look at affordability, but how do you do that in the context of modernization? So we're looking at artificial intelligence, how artificial intelligence can be deployed to help physicians in rural areas, to help nurse practitioners or places where they don't have physicians, how we can use artificial intelligence to actually do research, going back, like for instance, take a mammogram, something that you all may be familiar with. If you have a series of mammograms from one particular individual, and you can go back to the earliest stages and detect a cancer at its earliest point before even the radiologist could detect that cancer. So how do we deploy artificial intelligence to help us have a better healthcare system and detect things earlier? We're also using technology, wearable technology, digital technology to put patients in charge of their healthcare. Many of you are familiar with Apple Watches and the fact that you can have an electrocardiogram or EKG, and it may pick up and detect things. You're familiar with on television seeing scanners that detect glucose through the skin without having a pinprick. There's a huge amount of technology that's available that we can put in the hands of patients and consumers and their doctors. Some of that is going to require some changes in legislation, in reimbursement between providers and patients, but it can also be used for prevention in healthcare and putting patients back in control of their healthcare and their healthcare system. It really kind of it avoids that authoritarian approach, which is what we have now, meaning the government bureaucrats are telling you what you can and can't have. So to me, it's very disruptive in the healthcare sector. And then the last thing is interoperability. So interoperability between healthcare devices, between electronic health records, and then how can we use artificial intelligence to detect fraud, especially in the Medicare and the Medicaid system. So we're looking at that. That's just one aspect of what the Republicans are doing for healthcare and healthcare reform going into this next legislative session. So I'll end there because I want to hear your next guest, and then maybe if there's questions, we can answer questions.
Congresswoman, thank you. And I think that you gave us all some information that we did not know anything about. So that's really exciting. So Melissa, I know that Americans for Prosperity is working very hard on policy at the state and federal level on healthcare. So give me a little bit of idea of what you think is wrong with the healthcare system and why we need reforms that empower patients.
Absolutely. And I have to say, Dr. Miller-Meeks really has her finger on the pulse of the history of our healthcare system, and has really explained quite beautifully a lot of the origins of some of our current problems. So my comments are going to be a yes and addition to everything she had to say, because I have no disagreements there. But AFP has been involved in the healthcare space for a long time, basically since it was started. And our first, biggest foray into that was this campaign we called Hands Off Our Healthcare during the time that Obamacare, otherwise known as the Affordable Care Act, passed Congress. So we've said for a long time that more government intervention in healthcare is not the path forward. Our sister organization, Concerned Veterans for America, was one of the early groups ringing the alarm bell when it came to some of the wait times and really poor healthcare outcomes we were seeing in the VA. And so, as Dr. Miller Meeks pointed out, we already had a really good example of what full government controlled healthcare would and could look like in this country. And we knew that's not the direction we wanted to go. So we've been saying for a long time that there are some major issues with our healthcare system. A lot of it comes down to government interventions, which create some really bad incentives from an economic perspective. They create a lot of inefficiencies, bloat, fraud, waste, and abuse, as the saying goes, that really drives up the cost of healthcare. Every sort of additional regulation, mandate, tax and fee that's levied in the healthcare system gets passed down to patients and inflates that cost of care. And in addition, when government gets involved with healthcare and tries to provide healthcare solutions, they're always focused on coverage and not the actual provision of care. The Affordable Care Act, for what its name was, actually didn't really do anything to increase the supply or accessibility of actual healthcare services. It was all focused on getting an insurance card into people's hands, regardless of whether or not they could actually use it. For folks that have been kind of paying attention over the last several years, we've got a real problem when it comes to the supply of healthcare. Some of that's capital investment in terms of facilities, cutting edge equipment, medication, but also in terms of personnel. We're seeing from the National Physician Survey year after year that more and more doctors are planning on retiring. They're being pushed out of private practice. And so what is already an industry where we're seeing that doctor-patient relationship getting really eroded by all of these middlemen in the process, we're just seeing that worsen with a lot of very beleaguered doctors and skilled nurses who want to have a direct relationship with their patients, but don't get to make choices that are in their patient's best interest because of the way that our healthcare system, in particular healthcare financing, is administered. And so it's a very discouraging environment to work in. A lot of people are planning on exiting it, and we don't have enough people in the pipeline to replace them. So it frankly doesn't matter what we do in terms of Medicare for all, Medicaid for all, public option. Any of these government solutions only deal with the financing of healthcare. They don't actually address the underlying problem, which is we don't have enough supply to meet the demand. And so after, over a decade of AFP really talking about what's wrong with the healthcare system, our allies in Congress, our allies in state houses started coming to us and saying, hey, we agree with you. These are all terrible things about the healthcare system, but we need a positive vision for what we're going to do. And we don't have that sort of pithy thing like Medicare for all or the public option to rally around. So what is our actual solution to this problem? Which is why Americans for Prosperity last year launched what we're calling the personal option, which is an emphasis on individual patient empowerment, restoring that doctor-patient relationship, and putting healthcare consumers in control of their own dollars so that they can make decisions about what healthcare goods and services they need most, instead of facing a government healthcare system that's going to ration and decide for them what they need most. So I think we're probably planning to get into a little bit more detail about what some of those mechanisms are to put resources directly back into the hands of patients to make decisions, and some of the things that we're looking at the state level to remove barriers that are artificially restricting the supply of healthcare across the country. But really at the end of the day, we just wanted to refocus our healthcare system on being patient-centered, being about care rather than coverage, and really getting some of these middlemen out of the way that are really badly driving up costs in the face of what's already a tough market to access healthcare in sometimes.
Thank you, Melissa. The two of you have really highlighted some important things, and it takes us back. We're hearing about the personal option, and I saw Dr. Miller Meeks nodding her head. So I want to ask you about that argument between Medicare for all or the single payer option in comparison to this personal option. So doctor, what does that look like in healthcare, and what does that argument sound like among your peers?
Well, among our peers, I'm just going to tell you what I say in conference and when we have our task force meetings, and that is that the Democrats want a patriarchal, paternalistic system, archaic system of the past, whereas the Republicans want a personalized, state-of-the-art, futuristic system using technology to empower you to have your best health care. That's, to me, if we message that to the public, we'll be able to get people on board, because part of the challenge, I think, in doing any healthcare reform, and especially in the way Melissa talked, and I think she's talking about personalized health savings accounts, putting money in your pocket, letting you purchase health insurance, not having a community rating system so you can pick and choose what parts of healthcare, what parts of coverage you want, which can help you bring down cost. But then also it embodies personal responsibility. We have medical care and medical insurance, and then we have healthcare, of which we have some control over healthcare by our own behavioral choices. So that's the tagline I use, because it's something you can message to the public. And I very much think of Medicare for all in a single payer system as absolutely being paternalistic and being patriarchal, because it is an authoritarian figure, a bureaucracy that is going to be making decisions for you. It will, in fact, lead to rationing of healthcare, because government has to create a scarcity. As Melissa already said, there is increasing demand. Part of that increased demand has been driven by government actions. What do I mean by that? Well, the Affordable Care Act, or Obamacare, had 10 essential benefits. And so every insurance policy has to cover these benefits. Whether you want the benefits or not, they have to cover them. And that drives up the cost, both demand and drives up the cost. It's one of the reasons why cost, and the higher and the more you have to pay for your premiums, the more you say, I'm paying so much for my health insurance, I need to access the benefits. And that further drives up care. Think about auto insurance. Auto insurance and homeowners insurance is nothing like medical insurance. So in my mind, we don't have medical insurance. We have a prepaid benefit plan. So what Melissa and I are both talking about is making medical insurance, allowing you to have your own policy, your own account, where then you can purchase goods and services as you wish. And if you want to purchase a concierge service, you can do that. Where technology comes in and where it can help with cost savings is, in the past, you've always had to go through a provider or a system if you wanted to test your blood glucose, or if you wanted to get an x-ray or a CAT scan. You had to go through some other system in order to be able to do that. There was always a gatekeeper. Where technology can change that is technology is so far advanced that there are systems for measuring all kinds of blood tests, blood oxygen level, as you saw during the pandemic. When I went to the technology forum in Las Vegas last year, there are whole body scans that can be done. There is technology that will allow you to do things that are currently done in a doctor's office to be done remotely. So there's all kinds of new technology that can be accessed, but we're going to have to change some of the regulations we have on technology and be able to get some of that through the FDA to be able to be utilized. So personalized care through an account. There'll be have to be changes in state laws and state insurance laws. Provider relationships and licensure will have to be changed, and then how we reimburse access to that care. But the goal is to put you in charge of your care, for you and your provider to have a relationship, and to bypass the middlemen through the insurance company and or the government.
Okay, so there was a lot to unpack there, but there were some things that really stood out to me. I love it. I hope everybody is taking notes so that you can go home and do your own research. But I specifically want to ask Melissa about something that the doctor said. She mentioned these health savings accounts. I have an HSA. I did not know until just recently that only 1 in 10 people have an HSA. So Melissa, What is a health savings account? Why doesn't everybody have one? And why are they so popular with the people that do?
Yeah, so I also have an HSA. I love it. I've had it for years, and everybody I talk to who has one loves them. And yet, to your point, Christy, only 1 out of 10 Americans has one. And the reason that that is the case is because currently under federal law, you can only have an HSA, health savings account, if you have a very particular type of health insurance. And even then, the amount that you can put in that HSA every year is limited. And some of the uses of that HSA account are somewhat limited. You can't pay for all of the healthcare goods and services that you might want to have with that. Even so, what HSAs can do today is already pretty amazing and powerful. So basically the way that HSAs work, as the name is on the tin, they're health savings accounts. And basically if you have a high deductible comprehensive insurance plan, you have the option of adding on a health savings account. Like I said, it's limited how much you can put in per year, but you're able to contribute to that every year. And one of the lovely things about it is that that money is not taxed the same way that your salary is. So the money that you set aside in that HSA, you're already kind of getting an extra bonus pay in from that because you're not paying taxes on that money. And anything that you spend out of that HSA that's spent on healthcare costs that are approved as a use for the HSA is also not taxed coming back out of the account. So if we think about how much money gets taken out per dollar on our paycheck on taxes, that's already quite a benefit in and of itself to have that money go through that HSA. But the other thing is the patient directed nature of it. So essentially, you can use that health savings account to pay for everything from over-the-counter medications to other types of therapies that are recommended by your doctor that are not covered by traditional insurance coverage. So things like if your doctor were to say prescribe you needing to have massage therapy or some other types of holistic or alternative treatments to just, prescription drugs or some other more invasive procedure, a lot of those types of therapies and care are not things that are covered under traditional comprehensive insurance. But if it is something that's prescribed to you by a doctor, you can pay for those things through your HSA. So if you're curious, you can look it up online. If you look up in US law, there's a whole list of things that you can use that for. What we really want to see and what the next step we feel like in the evolution of HSAs is to really branch out who's eligible. We would love for everybody to be able to access this powerful savings tool. And we would really love to be able to see people contribute more on an annual basis. That's one of the first things folks ask me when they already have an HSA is, how are you guys doing with getting the amount I can put in there annually expanded? And it can, the other thing is to expand the number of things that you can use it for, right? There's certain things you can't use your HSA for currently, like Dr. Miller Meeks mentioned paying for a concierge service agreement with a doctor, direct primary care agreement. Those types of things you cannot pay for with the HSA right now, which really limits their usage in ways that's really kind of unnecessary. They're there for you to access healthcare. So if it's a legitimate healthcare expense, you should be able to use the money for that. So that's what HSAs are. It's a real shame that more people don't have access to them. If you get the chance to get one, I would highly, highly recommend it. Like I said, everybody I know who has one really enjoys the freedom and flexibility it gives you. And in the event that you're not actively using those funds, you've saved up that nest egg for future potential healthcare needs, that money can be invested and it can grow on itself. And so it's also sort of an investment and something that becomes part of your retirement planning and what have you in the event that you're not actively using it from year to year, and that money does roll over. So it's just a really powerful tool that helps provide people a level of control, stability, and predictability over having the resources that they need to pay for the healthcare solutions that they want. And really, the best thing that we could do when it comes to HSAs is grow their availability, grow their uses, grow our ability to invest in them.
So that takes us perfectly into the next question. Dr. Miller Meeks, in Congress, is anything being done to expand the availability of HSAs to more people? And what about increasing the options on what can be done with HSA dollars?
So currently, under the Democrat majority, there is not anything being done to expand HSAs. And if you recall, and I think Melissa will verify this, under the Affordable Care Act, President Obama was actually limiting what could be done in an HSA. So whether you were paying for over-the-counter medications, what you could actually use the dollars for was limited. That's since been changed. And one of the things I'd like to highlight that Melissa mentioned is the savings nature of that. So if you're in an employer who has traditional coverage, but also allows you to have an HSA, and then you leave that employer, you can continue to have that money in your health savings account, your HSA, your personalized medical account. And then later on, you can use that money to pay for long-term care insurance. You could use it to pay for deductibles and Medicare. So it can be a very powerful tool. As far as Republicans, when we get the majority, we plan to expand HSAs, both what they can be utilized for, the savings nature, purchasing insurance. So our goal would be to expand that because it is a personalized option. It's more in alignment with private health insurance, private medical insurance. We're looking at, I've already got 2 bills on trying to expand, under the Affordable Care Act, since that's what we have, Obamacare is what we have right now, trying to expand coverage for small businesses and small businesses to be able to offer coverage and or contribute to a health savings account. So there's a variety of mechanisms we're using to try to get more private coverage and to have less coverage dollars paid for by the federal government. So yes, expanding HSAs, expanding personalized medicine, putting consumers in control, patients in control is absolutely one of the tools that we have in our toolbox.
I want to say to you that what a little bit of peace of mind that gives me to hear you say that you're working under the Affordable Care Act, because that's what you have to work with now. And so I'm happy to hear, and I know my fellow Republican women are happy to hear that you're working within the means that you have right now. Another thing that Melissa mentioned was that direct primary care, and you referenced back to that. So tell me what your caucus may be thinking about when we do take back the House. What can we look forward to seeing with direct primary care? Is there a place that we can increase the availability of that? And can it be mixed in with Medicaid and Medicare at any point?
So Energy and Commerce is where Medicare and Medicaid resides. And so I am hoping, and right now, if I'm reelected, which I think I'll be reelected, even though I'm in a swing district in Iowa, I will be on Energy and Commerce, so be able to work on that section more. I'm on Education and Labor, which handles ERISA, which is private plans. And so the direct primary care model, I think, is a great model to be able to work on, which affords you the option to have a more continual relationship with your physician provider. And Melissa mentioned something about burnout, about physicians. There's so much administrative burden right now in medicine that there are physicians that are looking at retiring early. And, part of the Obamacare was meant to consolidate the industry. So we went from 50% of physicians being in their own private practice to now only 20% of physicians are independent. So they're either, they're either in a large network or they're a hospital-based employee. And if you're a hospital-based employee, you're more likely to do those things that the large system wants you to do. So expanding direct primary care, although that's not the section of the Healthy Futures Task Force that I'm in, I know in that section there has been talk about expanding direct primary care. Again, really solidifying and enhancing that relationship between patients and doctors, rather than going through the gatekeeper model and the bureaucracy of a government agent telling you what healthcare you can and cannot access. It's also a way to save money and save cost. Remember, when you're under a prepaid benefit plan, there's no incentive for people to take charge of their own healthcare, to adopt healthy behaviors. There's no incentive. They say we're paid for sick care, but really the system that the Democrats are putting forward is a system that will encourage people to not adopt healthy behaviors. So you have a carrot or a stick approach, but there's nothing in that system. if you're going to pay for the people that are sick, the people that are well and don't utilize a lot of healthcare are going to be paying a lot of money in taxes for people who take no responsibility for their own healthcare and their own healthcare choices. So you either penalize it or you encourage it one way or another. And under a health savings account, because that money accumulates and you save it, you can then use those healthcare dollars for what you want. You ought to be able to use your healthcare dollars for a gym membership or massage therapy. Under our current system, the current insurance system or federal government system, the more providers you add to the system, the more benefits you add for the system, the greater the cost that all of us pay. Whereas in the system under a health savings account with a direct primary care model or a massage therapy or a gym membership, you actually bring down costs because people adopt healthier behaviors because they're incentive and motivated to do that.
Oh, I love each thing that you're saying. We can see it coming together, and it does come down to that personal responsibility and what we know the foundational principles of our country are. I know your time is limited. I want to ask you a question before I let you go, and we will come back with Melissa with some other questions. But you are speaking to a group of ladies who want to help you. And so tonight, can you share with them how they could be the greatest help to getting this personal option pushed forward in their states or on the national level?
I'm going to say, do what you all do best. Republican women have always been the people that are making phone calls, doing the door knocking, getting literature out, bringing people together, holding forums. So continue to do that, continue to advocate, continue to, help your members of Congress get elected, help your new candidates. We have got just a huge slate of phenomenal candidates that are running for office this time around. And I'm so proud, I'm in a class of the largest group of women that were elected in 2020. And they weren't elected because they're women. They're elected because they've got robust resumes. They've got phenomenal experience and a body of knowledge and information. There are people who are very talented and gifted in their own right who happen to be women. So I would say continue to work hard for candidates, make your voices known, seek out the information. Kevin McCarthy is going to roll out the Commitment to America. I think we were going to do it this weekend, but now it's going to be the following week. So look for the 21st or 22nd, 23rd for the Commitment to America rollout. And I think you're going to be delighted with what the Republicans are putting forward that we know that we can make into law when we get the majority.
Congresswoman, we appreciate your time so much, for your expertise and your willingness to serve, because I think as each one of us have listened to you tonight, we see the depth of knowledge and what you've brought to Congress and what you're going to be able to help get done on healthcare. We thank you, and we will be working on this side to do all that we can. But I know that if we could all give you a round of applause, everybody would be clapping loud and making a lot of noise. So thank you for joining us tonight.
Well, thank you. It's my honor. And thank you for all of you do to help us as candidates. So we greatly appreciate everything that you do. And it was an honor to be able to participate tonight.
Absolutely. Thank you. Melissa, we're not going to let you off the hook. We have some other questions we want to ask. The pandemic really seemed to bring drug costs, the availability of drugs, and production considerations into everyday conversations. As you know, it takes 10 years and $3 billion to bring one new drug to market here in the US. Why are we literally reinventing the wheel when we could be importing life-saving drugs from developed countries that we trust? And also, we're hearing more and more about drugs that have FDA approval for some diagnoses, but not for others. What, if any, work is being done on proof of safety or off-label usage? And what can we do on the drug prescription area?
Yeah, absolutely. It's an excellent question. And every time I go into conversations with healthcare innovators, folks who are working on developing the next generation of prescription drugs, medical technology, you know, really kind of the bleeding edge of healthcare. This is usually the area where they have the biggest questions, because it's by far the biggest hurdle to innovating and taking sort of the quality of our healthcare, the types of treatments that are available, to the next level. There is a huge drag on the system when it comes to your point, getting something approved in the first place. And even once it's proven to be safe, going through all the rigmarole to get it to a generic production for a cheaper cost, or being able to use it for off-label uses, so on and so forth, being able to market it for off-label uses, which is deeply restricted at the moment, and getting insurance to cover medications that are being used for off-label uses. All of that stuff are huge barriers right now. And we know that there's a lot of work that can be done on this front, and we know it's possible to reform the FDA and FDA processes. And we know that because a couple of years ago, we passed a bill through Congress called Right to Try. This was a policy that started out in the states. The vast majority of states had passed this before Congress took it up. And it goes to show how powerful a role states can have in reforming even federal processes like those of the FDA. And essentially what Right to Try said was that if there's a medication that has passed phase 1 of FDA trials, which is the human safety phase, basically saying this is safe for use, but doesn't necessarily go past those to the phase 2 trials and beyond that affirm how efficacious it is for what they're, you know, kind of developing that treatment for. But if a medication is past that phase 1 and it's safe, that folks who are have really tough diagnoses, terminal illnesses, have the right to try. They have the right to use these medications to try and save their own lives in the event that they are facing those terminal or extremely adverse diagnoses. So that was kind of step 1 in this process, right? Was in these most extreme cases, making the point that compassionate use waivers through the FDA don't get granted very often. In the meantime, there are things that people are you know, begging to get into some of these trials to be able to try some of these experimental medications while there's still time for them to fight their illnesses. And if they're not suitable for a trial, which it's usually a very narrow group of people that are eligible to participate in medical trials, then they were really out of luck before, and there were no options for them. So Right to Try was such a powerfully important thing to start breaking down those barriers that were through the FDA that were preventing people from really taking control of their own healthcare and, again, trying to save their own lives. But it really just can't stop there. So really the conversation now when it comes to FDA reform is what is Right to Try 2.0? What is that next phase? And really that comes along expanding people's ability to make those choices for themselves around not just medications, but medical technology, and be able to use those if they choose to do so, especially after they've passed that first phase of safety trials. But before maybe they've gone through this entire process of approval. So that's something that's kind of a first order thing that we're looking at. And again, there's a lot of other niche work that can be done when it comes to prescription of medications. That off-label use, proof of safety stuff is really important in that there's a lot of medications that started out being developed for another purpose and ended up being really efficacious for treating other illnesses. And that's something that people in practice, you know, doctors and patients are able to figure out when they try these things out. But unfortunately, the folks who produce these medications, even if they fund their own trials and figure out that some of their medications are good for other uses, they currently can't market that or inform doctors that, hey, we actually have evidence that shows this medication could treat this other condition. They aren't allowed to give that information to doctors. So that's a real problem, that even though these medications take, you know, billions of dollars to bring to market, the folks that developed them and made that investment can even inform healthcare practitioners that there might be additional uses for those medications once they've been brought to market. So there's a lot of different stuff that can be done. It is a very deep well of reforms that we can and need to pursue when it comes to the FDA and the way that we regulate both medication, but also health technology. As Dr. Miller-Meeks mentioned, really integrating technological advances into the healthcare system is really going to drastically improve outcomes in ways that sometimes I can scarcely even believe when I see some of these technologies tested and run by some of our partners in the private sector. So really being inclusive of all of the above, and trying to make sure that as soon as we know these things are safe, that folks can make the choice to access those treatments, those technologies, and those medications is really kind of the cutting edge of what we need to do on that front.
Okay, so that takes me, I have to bring this up. We have had recent legislation come out of the Biden administration where they say they're going to drop prescription drug costs. Let's talk about prescription cost controls and why maybe those are not the best method.
Yeah, so this is one of those policies that sounds really great on paper, but kind of does the exact opposite of what it was intended to do. So cost controls are basically how a lot of the rest of the developed world manages their healthcare costs, but it's also something that dampens innovation, reduces outcomes, and leads to healthcare rationing. So anytime that we start talking about just putting ceilings on medications, the cost of medication, the cost of healthcare, that doesn't change the underlying dynamics that led to those costs being that way in the first place. So we're talking about healthcare. I'll use the healthcare analogy. What we talk about is addressing the root causes of why some of these prices are getting too high, and they are too high, there's no doubt. But really what cost controls do is it's if you had a thermostat and you just change the what it said the temperature was without actually turning on the air conditioner, you can slap another price label on it, but that really hasn't changed the conditions that led to that environment. And that's what we really got going on with these proposals to cap medication costs, is that money's got to come from somewhere, right? If we don't mitigate the pressures that are inflating healthcare costs, basically when we talk about capping prices, we're talking about restricting supply, which means fewer people are going to get access to these medications. We're going to see shortages. That's what we often see anytime we cap any sort of good and service that's price. When you put that price ceiling in, you create a shortage. And so that's what we would see. And frankly, that's what we've seen in other developed nations that participate in these types of price controls, particularly for medication. Folks on the left of center often like to talk about that they agree that our healthcare system is broken, but they say what we need to do is follow the lead of countries like the United Kingdom that has a nationalized health service. That's really not the path you want to go down. Back when a lot of those socialized healthcare systems were introduced and those types of price controls were introduced in those countries, they had a really young, healthy population. You had multiple young, able-bodied, working-age adults sort of supporting more elderly folks and their high healthcare costs in the system. And as those countries, their population growth has slowed and their populations are aging, what we're finding is their waiting lists for care are getting longer and longer, and the restrictions over who can access certain medications is getting smaller and smaller. And people who the government deems are already kind of too sick or too old or too whatever don't get access to that care because it's just not a good investment for those governments. And just that's really not how we want to take care of each other in the United States. So instead of just artificially setting price ceilings on certain medications, we need to ask why those costs are increasing in the first place and dive into fixing the competitive market forces that will allow those prices to naturally come to a more sustainable level.
Boy, we could just go on a long time on healthcare, but there's a couple other things I want to get in before we get done. We have covered topics to increase access to affordable quality healthcare with HSAs. We've talked about direct primary care. We've talked about prescription drugs. And then you started talking about these aging populations. So what about fixing and modernizing social safety nets like Medicare and Medicaid? Is there anything in the works for that?
Yes, absolutely. So Medicare and Medicaid are some of the federal government's biggest expenditures and fastest growing expenditures. That's not going to slow down anytime soon. And frankly, they're very outdated in the way that they're administered. And as Dr. Miller Meeks noted, in Medicare, we're really talking about these sort of fee-for-service systems. They're not very responsive to market forces. They don't help the folks who are on those systems to be able to shop smarter, to have more choices. There are some programs within Medicare, like Medicare Advantage, that allow a little bit more choice, and we see better outcomes in those. So really, when it comes to Medicaid and Medicare, it's really about, again, just like it is with private sector healthcare, about increasing efficiency, cutting out bloat, waste, abuse. We see a lot of improper payments in the Medicaid system. Americans for Prosperity Foundation, our sister organization, actually sued the government on a Freedom of Information Act request to get information about improper payments in the Medicaid system, and you would be shocked. The findings that in some states and some years, 40% or more of Medicaid payments in that state were improper payments. That's a huge drain on the system, right? So I think more accountability in those systems, more efficient, more modern systems from a technological standpoint are important, and infusing more choice and putting those dollars directly in the hands of patients is going to be really important. And this extends both to Medicare and Medicaid traditionally, as well as those subsidized healthcare plans and the Obamacare exchanges, which are also part of that safety net that serves lower income folks. My colleague, Dean Clancy at Americans for Prosperity, recently co-wrote a paper. It was released in June called the HSA option that proposes that we take some money that's currently being funneled directly to insurers through Obamacare and instead repurpose that to give folks who are on Obamacare plans HSAs. It would not cost the federal government a single cent more because we're just taking money that would have been going straight into insurers' pockets and giving it to consumers instead, but instantly giving them HSAs and allowing them to drive their own healthcare spending, which again, makes them more cost conscious, makes them smarter shoppers when it comes to healthcare. And it also reduces a lot of overhead administration when that money is going directly to patients for them to use on healthcare costs instead of through a middleman like an insurer. So there's a lot of really cool things that we could do even within the context of the existing safety net to make it more efficient, to make it more accountable, and to make it more sensitive to the marketplace, which is ultimately what's going to increase the quality and decrease the price, because healthcare providers are going to have to be competitive in that environment in order to capture people's healthcare dollars. So those are just a couple of the things that we can do on that front, but there's a ton of work that we can do in Medicare, Medicaid, and with Obamacare plans.
Okay, Melissa, so there's an old saying that says government goes to those that show up. So I want you to finish up by telling us how we as women in the NFRW can help push these healthcare reforms.
Absolutely. So I'm going to refer to a comment I saw in the chat from Peggy Ostrander saying, help us in Texas. We have some of the worst healthcare access laws in the US, especially regarding nurse practitioners and access to other healthcare providers. The physicians in the Texas legislature are against expanding access for anyone but physicians. Any ideas what we can do to overcome this? Yeah, absolutely. talk to Christy, talk to Americans for Prosperity. First and foremost, go visit personaloption.com. That has our whole list of reforms, both federal and state, that we're pursuing, that sort of make up the menu of things that we need to do on that supply side that we were talking about earlier, on the finance side when it comes to reforming some of these government healthcare programs. So that's a really great place to start. But really, it just takes action. I have seen us break through in other states just this year on that nurse practitioner issue. And it's such a simple pitch, right? Let people practice at the top of their license. You instantly expand access to healthcare. You instantly increase the supply of healthcare. We've passed that in West Virginia. We've passed that in Arkansas just this year. So it can happen even in the face of a lot of physicians in the legislature that want to kind of protect their own financial interests, which I get. But really, at the end of the day, we need more supply of care. And when you have skilled nurses who are able to provide that care immediately, as soon as they're allowed, we got to take that step first. And so there's lots and lots of stuff that we can take action on come this January, when most states head into session, Texas included, where we can get these bills. Things move much faster at the state level. We can get bills passed this coming year to make some of these changes. So get with your local AFP chapter, americansforprosperity.org. You can find information if you aren't already active with your local Americans for Prosperity chapter, and visit that personaloption.com website to learn more about the specific reforms that we think will make the biggest difference.
Melissa, you have been awesome tonight. I think you have just really given us a lot to think about. We do have the power to help AFP and our congressmen and women make these changes, but we need to be the driving force from the bottom up, because again, government goes to those who show up. And with that, I'm going to toss it back to Glynis. Thank you, Glynis, for letting us talk about healthcare. Thank you, Melissa. And I just hope we all go home and do our homework now.
Thank you all. This was so much fun.
Absolutely. Thank you so much, Melissa, for joining us. This was fabulous. And Christy, rock star. I knew you would blow it out of the water, and you did. This was such a great interview. I love the panel. The Congresswoman was amazing. This was just wonderful. It was really, really good. And I know that healthcare, it affects all of us, everyone, no matter what your age, where you are in life. You're right. You know, as women, this is very personal to us. So thank you. We all needed to hear this. We needed to know what we can do going forward to really make a difference in our country, because we have to. So if you enjoyed this month's Empower Hour, then join me next month on Tuesday, October the 11th, where we will talk with Molly Hemingway. She is an author and Fox News contributor, and she will be talking about how the 2020 election was rigged. I know we all have heard lots of stories about how the election was stolen or this or that, and she's going to say, no, it wasn't stolen. It was rigged starting 2, 4, even maybe 6 years before. So very, very interesting. And she's an investigative journalist. And I've heard her talk and read her book and was amazed at some of the things that she has come up with, that she has dug up. And it makes a lot of sense. And it really is proof positive that we have to start well before election season to know to affect the outcome of an election. So I hope that you will join me on October 11th to hear from Molly Hemingway on the next Empower Hour in October. And just a heads up, November, we will not have an Empower Hour because that's election day. And I hope that we are all going to either be working at elections, doing something, or have our noses stuck to a computer and calling all of our friends and throwing popcorn at the TV whenever a Democrat wins something, and cheering profusely whenever a Republican wins, because we've got to take back the House and the Senate. So thank you all again for being here. Thank you, Melissa. Thank you, Christy. And thank you, Erica. And thank you all, ladies, for joining me today. And I look forward to talking to you next month. Until then, ta-ta.